15 to 18% of children in the United States live with a chronic health condition. This means that over 3 million children are hospitalized each year in the U.S. The most common causes of these hospital stays are due to the following illnesses. Fortunately, there are many ways for patients to reduce the negative effects that hospitalization has on children.
According to family systems theory, when a change occurs, it affects the family as a whole. When one child is hospitalized, the whole family is affected in numerous ways. For example, hospitalization is very expensive, regardless of the diagnosis. You may have to take on more hours at work to afford the numerous tests and procedures your child will need. Another example of the family systems theory is the effect that parental anxiety and distress has on the child. The more stress and anxiety the parents show, the more the child's stress level increases. You, as a parent, should do everything you can to become familiar with and educate yourself on your child's illness. Once your child sees that you are comfortable and calm, they can begin to cope with their situation. Moreover, try to include siblings in hospital visits and help them to understand what's going on so they do not feel ignored or left out. They may even want to help their sibling by having a specific task while they are at the hospital. A few ideas include simple things as simple as allowing them to help decorate their sister's hospital room or letting them hold their hand during a procedure.
Every child's treatment plan varies, but there are a few ways to help your child thrive during their time in the hospital. As a parent, you can utilize medical play in order to help prepare your child for any medical procedure she may be scheduled to receive. Medical play promotes age-appropriate discussion about your child's medical procedures in order to help her realize that she is not the only one going through this process. Additionally, medical play can help to familiarize your child with the procedure prior to experiencing it. A few tips for medical play are: allow your child to control their own play, be present during this play to encourage your child's exploration, and limit how many questions you ask your child to give her a true sense of freedom. Taking your child on a tour of the hospital facilities before or right after they are admitted is a great way to familiarize you and your family with the new environment where much of your time will be spent. A hospital tour will allow for exploration of the operating and procedure rooms. Being able to see these rooms as non-threatening reduces the stress and anxiety many children and family feel before surgeries and procedures.
Both the illness as well as the treatment for the illness may be quite stressful for your child. By attending medical appointments and spending time in recovery, your child may be unable to participate in activities that other children enjoy doing. Most likely, your child will miss school, which means they will lack opportunities for learning and playing. Moreover, your child may be physically less able to take part in leisure activities alongside other children, which may cause them to feel different and less independent in comparison to others. It is important that you focus on what your child can still do, instead of focusing on what she can no longer do. With some creativity You may alter your child's favorite leisure activity so they may continue to experience it in some form while in the hospital.
Hearing the diagnosis of a long-term illness may seem like a traumatic, life-altering moment for you and your family. However, the most powerful tool you may utilize to fight this illness is actually the strength of your family as a whole. Sustaining regular family routines, talking to siblings about the illness, and becoming familiar and educated on your child's illness can help exponentially. Additionally, familiarize your child with their treatment through medical play, and most importantly, allow them to take part in safe but enjoyable activities. As a family, you may work together to overcome this illness.